Hello, AEGD residency candidates. I'm Dr. Brooks Woodward. I'm the dental director here at Chase Brexton Health Care, one of the clinical training sites for NYU's AEGD program. We have created a virtual clinical tour for you so that you can help visualize yourself here in the clinic and just get an idea of what our clinic setting looks like. The tour is intended to be very brief, followed by an interview. Where we'll go into much more detail about the residency program itself, what the requirements are, what your schedules might look like, procedures you might do, what you expect to get out of your AEGD program, what we hope you get out of your AEGD program. Please visit our website at chasebrexton.org for more information on our federally qualified health center, and please email me at bwoodward@chasebrexton.org with any questions or to schedule an interview. I look forward to hearing from you. I look forward to having an interview with you, look forward to working with you in your residency, and please enjoy the virtual tour and best of luck. Thank you.
Hello again. We're now standing outside of our main location, which is 1111 North Charles Street in Baltimore, Maryland. The area of town is called Mount Vernon. We're on the 6th floor, the top floor of this building behind me. Just a few numbers. Our health center has been around for 42 years. Our dental services are entering in their 20th year here at Chase Brexton. This December will be our 20th anniversary. I've been the dental director here for 20 years. One of our other clinical staff dentists has been with us for 14 years. Our other staff member, 6 years, and that was after completing his year of AEGD residency through NYU. So he has a nice perspective here. This area of Baltimore, if you're not familiar, we're nestled nicely between Washington, D.C., Philadelphia. We have a 2-hour train ride to New York. The train station is actually 3 blocks to the right. We're surrounded by undergraduate and graduate school campuses. We have Maryland Institute College of Art off to the corner. We have Johns Hopkins undergraduate to the right, University of Maryland's graduate campus, including its dental school to the left. Behind us is Johns Hopkins graduate campus. So this area has a lot of young people. It's a nice, vibrant area to live in. Most of our residents get an apartment here and just walk to clinic services. So next step, we're going to move inside and go up to the 6th floor where we'll show you our dental clinic. I'm going to have a mask on when we go in. We're taking all the CDC and ADA precautions for COVID-19. So when we encounter some of those, I'll point them out. But next time I see you, we'll be inside in the dental clinic. Thanks so much. So hello again. We are now inside the dental clinic on the 6th floor of our building. I'll point out our reception area. It's got socially distanced chairs. I'll point out our plexiglass coverings for all of our patient service representatives. I'll point out my mask. We have adherence to all CDC and ADA recommendations for COVID-19 in the building. So all staff, all patients will be wearing masks when they come into the building. At the front entrance when you come in, everyone is screened for COVID-19 and has their temperature taken. Patients are given a color-coded band for each day of the week so that when you see them walking around, you know that they've successfully passed COVID screening that day. Our patient service reps will be the people who schedule your appointments for you, who confirm your appointments, who go over insurance and fees with patients. They also do COVID screening at the making of the appointment, at the confirmation of the appointment, and a third time when the patient checks in, they actually fill out a COVID-19 screening and sign it. It becomes a part of their permanent record. So we're going to now head into the dental clinic itself, and I apologize if I turn my back on you a couple times, but I want to give you a sense of walking through the clinic and what the size and what it really feels like to be in the space. So we'll just head this way. You'll get an ID badge when you become a resident that allows you access to the building and access to the dental clinic. So we'll move on into here. Our dental clinic is set up essentially like one large rectangle with operatories that surround both sides and a workspace in the middle that we call a pod. We have 10 operatories here. 2 of them sit off to the side like this, and the other 8 run down this corridor.
This is a connecting corridor, and then the other 4 run down that side. So 8 over here, 2 over here, with a pod in the middle of the 8 on this side. So let's walk this way, and you'll get another sense. We're going to walk down this hallway, down the other corridor, and we'll go through a couple of operatories and into the pod, and then back out here again, so you can see how the whole loop kind of works. And again, apologize for my back. This is one of the entrances into the pod area, which we'll go through later. My office, which you don't need to see, it's a mess. We pass a Panorex alcove here. So our Panorex machine, we have a mobile nitrous oxide unit that can move around to any operatory that you need to use it. We have emergency medical equipment over here in case you have a stat call. We have a stat team that will come when a stat call is placed. Hopefully you never have one of those things. Keep going this way again. This is another one of the entrances into the pod area. And we'll walk around to the other side of the corridor. These are the other 4 operatories. They are all identical. Every room is set up exactly like every other room. Let's go down here and take a peek at a couple. We'll come into 10.
No.
We happen to have a rotary endo tutorial going on with a couple of our current residents in here, so I won't bother them, but just to point out the room space itself, and then we'll go into this next one here. All of our chairs are ADEC equipment chairs. We have a fully integrated electronic health record here at Chase Brexton. It's called Centricity. It's a GE product, and the dental component is called Viz Dental. It is fully integrated with medical, pharmacy, any other services that are offered here. So you as a dentist have access to look at medical chart entries, allergies, any medical problem lists, prescriptions written, lab work, any labs that the patient has had done are all incorporated into the record. So it's kind of nice that you have access to all of those things in one chart. Digital radiography, of course. We do have a Solea hard and soft tissue laser. After a little training, you are permitted to use this on any hard or soft tissue procedures that are appropriate for this laser here. This is one of the back doors that I was talking about. So this leads into the pod that we walked by a couple of times ago. Again, this is where the providers sit. So residents typically on this side. Our staff dentists over here. We can move this way. This is just supply storage. We have a sterilization area in the middle here where all of our assistants work. Lab storage is on this side. You'll get 1 dental assistant for the year that you are here. They bring your patients back, they seat your patients, they take your patients for x-rays, impressions, they do all of your instrument sterilization and your room setup and breakdown. We can head back through this little door again, back to where we started. Here we are again, back in the hallway, and really that is the whole clinic space here. So I hope it gives you a glimpse of what it would be like to work in this area. We are doing all of our interviews virtually this year, so I look forward to hearing from you to set up an interview. Good luck with graduation, good luck with your boards, stay safe, and I hope to hear from you soon. Thank you very much.